Good day, my name is Anita Enablement, PS Message 2 student. I'm going to be demonstrating how to administer oral medication. So with the way my camera is set up, you might not be able to see my face, but I hope you can see my workspace clearly. So before I go in, I'm going to check the medication record for appropriate lab work or allergies. I'm going to be administering Condorcetan. So I'll check the lab work, and I'll also validate the medication, the transcription with the mass. Then perform my hand hygiene. Gather my equipment, which is the water cup and the medication cup. It's not needed. Then I will retrieve the correct medication, checking the name and dose. So this is Bennett John, June 12, 1942. Condorcetan 16 mg PO once daily. Check it. Then the indication for this medication is used for high blood pressure. It blocks vasoconstrictors and aldosterone secreting effect of the angiotensin 2 by selectively blocking the binding of angiotensin 2 to the AT1 receptor in many tissues such as the vascular smooth muscle and the adrenal gland. So the action is independent of the pathways for this angiotensin 2 synthesis. Okay, so before I prepare my medication, I will do my second check. If I was to crush it or prepare it any other way, I'll do my second check. So this is my second check. So this is perfect. I'll also check for expiry date, which is, it's not written here, but it should. I didn't write it, but normally it should be written, and I'll just put maybe June 2022, and it's not expired, so it's still correct. So I'll leave this here, and then I'll take my medication and my water cup to my patient room. Let's see. I leave and come back to my patient room. So I would have normally carried only the MAR form to the patient room because I have to verify the patient's name and the MAR. So with my correctly prepared medication, I'll transport it properly if necessary. Then I'll go into the patient room. Good day, Mr. John. My name is Anita. I'm here to administer your medication. But first, can I get your name and your date of birth? John Bennett, date of birth, June 12, 1942. Perfect. And can I check your ID bracelet, please? Okay, I'll check it with the mask. Okay, it matches. So today I'm going to be giving you Condorcetan as part of your routine medication. It's for your high blood pressure. Some of the side effects are lightheadedness, chest tightness and heaviness, and sometimes cough and crossness, or sometimes fast and irregular heartbeats. Okay, so now, do you have any questions? Okay, So now I'm gonna position you to a high fowler position to be able to take your medication. I will raise his bed to a high fowler position. Then before I give him the medication, I'm gonna do the third check. And make sure not to touch the medication. Okay. Are you able to swallow this? Right here, and here's your water. Okay, perfect. So he has finished taking the medication. I'll come back. I'll come back in a few minutes to check your blood pressure and do the necessary assessment. I'm supposed to check his blood pressure before I gave the medication because it's a part of the necessary assessment. Okay, so then I will dispose of this, take this back to my station, and then in my station I will sign that I give Condestan today, which is the 13th, AE for the morning dose. And I'll also sign my name here. For record purposes. Thank you.